Florence Nightingale, 1820 to 1910, was an English nurse, statistician, and social reformer who is widely regarded as the founder of modern nursing and one of the most influential figures in the history of medicine and public health. She was born on May 12, 1820, in Florence, Italy, into a wealthy and well-educated British family. Her parents, William Edward and Frances Nightingale, were members of the upper class, and she received an exceptional education, studying mathematics, philosophy, literature, and languages, an unusual privilege for women of her time. From an early age, she showed a deep sense of compassion and a strong religious calling to serve humanity, which she interpreted as a divine mission to alleviate human suffering. Despite her parents' objections and the strict social expectations placed upon women of her background, Nightingale was determined to pursue a career in nursing, a profession then considered unworthy of educated women and associated with poverty and immorality. In 1844, she began studying nursing informally and later received training in Germany at the Institute of Protestant Deaconesses at Kaiserwerth, where she learned about hospital management, hygiene, and patient care. In 1853, she became superintendent of the Institution for Sick Gentlewomen in London, where she demonstrated exceptional administrative ability and a commitment to improving sanitary conditions. Her reputation soon spread, and in 1854, during the Crimean War, the British government asked her to lead a team of nurses to care for wounded soldiers at the military hospital at Scutari, near Constantinople, modern-day Istanbul. When Nightingale and her nurses arrived, they found the hospital in a state of chaos. Soldiers lay in filth and overcrowded wards, supplies were scarce, and infections spread rapidly due to poor sanitation and contaminated water. Moved by the suffering she witnessed, Nightingale implemented sweeping reforms. She organized the cleaning of wards, improved ventilation, secured better food and medical supplies, and established laundry and bathing facilities. Her insistence on cleanliness, order, and proper nutrition, combined with her rigorous record-keeping and use of statistical data, led to a dramatic reduction in the death rate, from over 40% to just 2% within months. Her tireless efforts earned her the admiration of soldiers, who affectionately called her the Lady with the Lamp, because she would make her nightly rounds carrying a lamp to check on the wounded. When she returned to England after the war, she was celebrated as a national heroine. But she used her fame not for personal gain, but to advocate for large-scale reforms in military and civilian health care. She authored several influential reports, including notes on matters affecting the health, efficiency, and hospital administration of the British Army, which exposed the poor conditions in military hospitals and influenced sweeping changes in the Army Medical Department. Her groundbreaking book, Notes on Nursing, What It Is and What It Is Not, 1859, became one of the first professional manuals for nurses and remains a classic text in nursing education. In 1860, with funds raised through the Nightingale Fund, a public subscription established in her honor, she founded the Nightingale Training School for Nurses at St. Thomas's Hospital in London. The school's graduates went on to work across Britain and the world, spreading her methods and values, which emphasized sanitation, compassion, discipline, and careful observation. This initiative effectively transformed nursing into a respected and scientifically grounded profession. In addition to her work in nursing, Nightingale made major contributions to public health and sanitation reform, particularly in India and in Britain's urban areas. She was one of the first to apply statistical analysis to social reform, pioneering the use of visual data presentations such as her famous coxcomb diagrams, which vividly illustrated the preventable causes of mortality among soldiers and civilians. Her innovative use of data persuaded both the public and government officials to support sanitation reforms and public health initiatives. Although she suffered from chronic illness, possibly due to brucellosis or spondylitis contracted during her time in the Crimea, she continued to work tirelessly from her home, producing hundreds of reports, letters, and essays. She advised the British government on health, sanitation, and hospital construction, helping shape modern healthcare systems. In recognition of her service, she became the first woman to receive the Order of Merit from the British Crown in 1907. Florence Nightingale passed away peacefully on August 13, 1910, at the age of 90. And although she was offered burial in Westminster Abbey, she chose a modest resting place in her family cemetery in Hampshire. Her influence endures in hospitals, nursing schools, and public health systems around the world, and her name remains synonymous with compassion, discipline, and the application of science in the service of humanity. Florence Nightingale not only revolutionized nursing, but also redefined the moral and professional ideals of care, proving that rigorous science and deep empathy could coexist in the pursuit of healing and human dignity.